Hi, my name is Brandon News with Healthcare Compliance Pros. Thank you for taking some time to learn more about what we do to help healthcare organizations become and remain compliant. Before we get into that, I wanted to give a brief overview of our company and our purpose. HCP was founded in 2011. We currently work with over 4,500 healthcare organizations nationwide. We are backed by seasoned compliance professionals, an industry-leading client support team, and the latest and greatest in technology to automate your compliance efforts. A common misconception is that compliance consists of only annual training, which is why we still see so many fines and findings being handed down to healthcare organizations. There's a need to bridge the gap between just training on policies and making sure they are implemented correctly. Let's take a look at some of the data. Studies show that 74% of healthcare organizations don't know the full scope of compliance standards they are expected to meet. Only 3 out of 10 groups surveyed are confident that their compliance knowledge meets the full scope of federal requirements. 87% of organizations say they are not meeting at least some of the requirements they do know about. Only 1 out of 10 healthcare groups are confident they are meeting all of the federally required compliance metrics. Companies are paying out an average of $820 per employee every year in non-compliance costs. That can break down into fines, litigation, and corrective actions. One patient record is compromised nearly every second in the US as a result of cyber attacks. Investment in user training reduces security-related risks by up to 70%. As you can see, having an effective compliance program can greatly reduce your risk of exposure. For HCP, compliance is about more than just training. We provide you with a comprehensive compliance program that meets federal requirements. We tailor it to the needs of your organization. We provide automatic updates and the technology to keep everything streamlined and automated. Our audit support and protection is unlike any other. We provide advice and support in responding to an audit, help with showing documentations of your due diligence, plus we provide up to $1 million in indemnity coverage. We've been through over 1,500 audits with our clients and have never had a fine or finding handed down. Our billing and coding support will allow us to identify risk areas on a per provider level, utilizing the same tools payers are to find areas of increased risk based on multiple variables. We can provide coding audits to not just increase coding compliance, but also to find areas to increase revenue, as well as develop specified trainings for your group focused on coding pain points. At HCP, our goal isn't to just provide you with the tools you need, but to also manage your program with you. Our support is second to none, and we will not just help you to customize and implement your program, but we will be with you every step of the way. From technical support to compliance research, our team is invested in ongoing guidance and help to ensure you not only meet all of the federal compliance requirements, but that you can maintain them year in and year out. The core features of our program include unlimited technical support, which will include the hands-on trainings within the program for administrative staff to ensure a comfortable understanding of the compliance tools and resources available. Online trainings that will include content and policies customized to your individual organization. Automation of compliance trainings and tasks to streamline your efforts throughout each year. Historical reporting on your training and compliance efforts for as long as your program is active, a library of complementary compliance forms available for your use, such as templated BAAs, HIPAA logs and reports, COVID-related documents, sample letters and forms, and even HR documents. Our team will also take on the burden of updating your content when new regulatory updates are announced so that you can focus on your efforts in the areas that matter the most. The data shows that HIPAA requirements are one of the biggest hurdles for healthcare organizations across the nation. Over the last 2 years, there have been almost 20 right of access enforcements, resulting in an average of $65,000 in fines. Many of these enforcements come from a right of access request that is either not fulfilled in a timely manner or not properly fulfilled based on patient requests. 67% of audits fail due to insufficient security risk analysis. More than half of HIPAA breaches include a BA in the compromise of personal health information. When a BA fails to meet HIPAA standards, it can negatively affect the associated covered entity, which is why it is so important to have a HIPAA incident protocol developed and in practice. Only 16% of OCR investigations result in 0 findings of a violation. As of April 2021, the applicability date for information blocking goes into effect for provisions for your organization. Let us help you develop the appropriate policies to protect your group. As part of our HIPAA program, we're going to include content for HIPAA privacy and HIPAA security from a federal level. This will include customized content for training for your employees as well as your administrative staff. We'll help to track business associate agreements, expiration dates, and will provide a centralized location to keep everything organized and easy to access. We'll be providing a guided security risk analysis. That is an annual requirement based on the HIPAA guidelines, and we want to make sure that it's going to be sufficient so that your organization is doing everything that's required from the perspective of the OCR. We're also going to be including additional assessments like a HIPAA threat matrix, as well as HIPAA virtual walkthroughs to ensure that you're taking a more proactive approach to your program and identifying areas of concern before they turn into a problem. HIPAA incidents are a very big portion of a HIPAA program to make sure that you have a protocol in place in the event of a HIPAA incident to be able to determine, is this a breach? If so, do we need to report it? How soon? When and where do those things need to go? And HCP will be alongside that process to guide you and make sure that everything is being documented so that your program remains sufficient. HCP will also be providing audit support. In the event that your organization is audited, HCP will be with you along the entire process to make sure that you have the guidance and the support that you need to be able to provide the documentation that the OCR may be looking for to ensure that no fines or findings are handed down as a result of an investigation. Our OSHA program is going to cover industry specifics like bloodborne pathogens exposure, handling hazardous material, general safety. We will provide a virtual SDS binder that is searchable and easily accessible for all of your employees. We will also be providing a hazard risk assessment as part of your OSHA materials, an OSHA self-inspection, and we will also provide audit support in the event of an audit. HCP will be with you, will guide you through the process, and ensure that you have everything that you need in place to provide to any auditors if that were to be necessary. Any healthcare organizations participating in any federally funded programs such as Medicare or Medicaid are also required to implement a corporate compliance program. Content in your trainings include things like fraud, waste, and abuse, whistleblower statute, Stark and anti-kickback. We'll also be including things like your monthly exclusion list monitoring against the OIG LEIE list, as well as the SAM exclusion list. We'll be helping to track compliance committee meetings. We will also be including a compliance hotline for your employees to have an anonymous resource in the event that they need to submit concerns or ask any compliance-related questions. We will also be providing a compliance risk analyzer. Our compliance risk analyzer allows us to examine your billing and coding practices on a per provider level. We'll go over the last 12 months of billing and coding history, and we'll identify any increased risk. We'll be able to provide comparison to a national average as well as a local average, including specialty based on 5 different variables that we've taken into account. The algorithm that we are using is similar to the one the private payers and the OIG are using when examining billing and coding history for increased risk. From here, we are able to provide recommendation. We can provide education and training. On completion of the coding risk analyzer, we can also provide coding auditing. This will allow us to go through and review per encounter, whether E&M, whether complex. We can also provide reporting with the statistics from the national averages, as well as the specialty and the geographic averages. We can look at the education and the follow through, developing specific trainings based on the findings, as well as doing our due diligence and documentation to correct any issues that we have found. We will also be looking for areas to increase revenue by finding adjustments that can be made in billing and coding practices. As part of our HR program, we will be providing access to content and policies to customize for your organization. That can include things like employment law, pre-employment checklists. We also have a way to track credentials through our credential manager. Part of our HR program will include our employee virtual binder, which will allow for individual employee tracking, documentation storage, acknowledgements, as well as reminders. Our learning management system will include over 130 course titles developed around healthcare specific topics. We will also be including continuing education credits and blank modules to allow you to be able to create your own course content for your organization-specific trainings you would like to roll out to employees. Take a look at some of our customer testimonials. With over 4,500 partnerships nationwide, we help a wide variety of organizations, including billing companies, MSOs, RCMs, hospitals, universities, private practices, and even specialty groups. If you're interested in finding out how we can help your organization tackle compliance, please give us a call today and we would be happy to customize a solution for your group.